And while coming to the quiz session, just I will tell some rules for this quiz session. Okay, and there is the main objective of this question includes that four options are there for each questions, and those who thinks correct should say A, and one may answers along with the co-answers. One will be the main that answerer, and their co-supporters should be there. And similarly for that will be A, for B and C and D. And for no options answer, there will anyone can reply and the correct answer as you listen this slides. No, from this slides only I have just made quiz sessions for just the next slide, please. Yeah. Next slide, please. Yeah. Here the question is mentioned: which clinical form of acute tonsillitis is shown in the pictures? There are four options. Okay, there's acute catheteral or superficial, or acute follicular, acute membranous, and acute parenchymatous. It is there. Just guess your answer. And one can say A, and their co-supporters should be there for A, and for B also similarly for B. If those who wants to say about B answer is correct, just see the here clinical features of the. Hello. Hello.
Yes, Dhanraj.
Is everyone is listening? As you can see here in the pictures, this these both tonsils are inflamed, and some that yellowish crepes are present on the tonsils, and your this will also shifted to other sides. Okay, and some whitish material layer is on the tongue. You can see here, and you can guess your answers from here. These options are mentioned. Yes, I will give you the hints. Okay, in follicular, I just already told. No, there will be yellowish spot color will be there. That is the main distinct clinical features of the follicular. There will be yellowish spots will be there, and redness and swelling will be there in the tonsils. Okay, but in parenchymal, there will be like enlargement will be there, but both tonsils will be equally enlarged, and your beulah will be like, and soft plate will get some edema or redness in color will be there, and some membranous will be there, like whitish membrane will be there, and the medial surface of the tonsils will be there. In small clear patches will be there. Just guess it. Which one is correct?
Is that C? Membranous.
Membranous. Yeah.
C.
Yeah. Other persons can also tell your answer. I will tell later. Yeah, Sripriya, I think you are Sripriya. No, your answer is correct. You.
Yeah, both Sripriya and Shibi madam.
Yeah, your answer
okay,
is
brother.
correct. Yeah, okay. And next slide, please. Prasad, can you show next slide? Yeah, there is second question. Which is the most common bacterial pathogen causing tonsillitis? Just anybody, if no, then answer it. It is from that causative agent from the bacterial organism involved. Most common, I told no previously, most common bacterial pathogens causing tonsillitis. It will start with yes. Yeah, it's correct. It's correct. And the second, the third question is: which one of these complications is not caused by the acute tonsillitis? Just here are the four options: rheumatic endocarditis and laryngitis. It is there. Laryngitis. It is there, and agranulocytosis is there, and retropharyngeal abscesses. It is there. If you know the upper respiratory tract, then you can conclude from there. And in general clinical features of tonsils. Huh? Hello?
Agranulocytosis. Hello?
Agranul.
Is it
Yeah, you are correct, Sarad. Are you no? Yeah, it's correct. It's correct, yeah.
Like because
There will be less.
this is the gland which produces
yeah.
all those granulocytes.
Yeah. There will be lesser chances of getting granulocytosis in tonsillitis conditions. Yeah. Next slide, please. I think it's got completed. Yeah, these were the references I just took to make my PPT. These were the information, because generally I prepared this one, but I'm preparing for general and common disease conditions. Okay, this was the one of the throat disorder, and upper respiratory tract disorder, and this I thought, and this is generally it's asking in our examinations also. It's generally asking in the licensing medical examinations, pharmacy examinations, and it will be beneficial to to know the different types and classifications for distinguish. Same like these questions, it's asking in our examinations in our country. So I prepared for this, and so this topic will be so much helpful for me. And even though you all guys also will be able to distinguish the types of this tonsillitis, will be knowing for general treatment will be knowing, but it will be difficult to recognize the types and their clinical features. Okay, thank you for your attention. Have a great day. If you have any questions, then you can share, or if you have any good information regarding this tonsillitis, you can share your answers.
I had one doubt. I remember like reading thymus gland produces all those lymphocytes, everything. Is it the same? Tonsils and thymus gland?
Yeah, thymus glands also produces, yeah.
Okay. Is it the same? Or?
I think maturation of those will take place in thymus, no?
Not the production.
Yeah.
No, maturation happen in thymus, I think.
Okay.
Yeah, tonsils generally it will produce lymphocytes, and some really there will be the productions of also thymus. Thymus glands also is involved in it.
Is this contagious, brother? Like tonsillitis is contagious?
Yeah, contagious.
Hello?
Yeah, it is. Yeah, it is.
Okay.
And then like using antibiotics like for all these kind of infections, like oral infections, it can affect the oral bacterial flora also. No? Can it cause any oral thrush or any other infections associated with the oral cavity?
Oral cavity. Yeah, I already told you, the complications which are causing. Already you can see the previous slides. It was that there will be chances of getting that acute otis media, or you will be getting that endocarditis acute, and there will be so many osteomyelitis, and some sinusitis also will be there. Some complications will be there, and this upper this respiratory tract will be infected, like this laryngitis or cancer of larynx will be there. Bronchitis will be also the complications.
Okay. Like those patients undergoing tonsillectomy, like how the what happens to the immune system? Like, will they receive any vaccines or something like that?
No, there is no vaccines for it. Just it is there. This immune system that will that will defense against your your against your infections. Okay, but even though they are just those people who are going for the surgery, just they will give the for prophylaxis same that antibiotics and painkiller will be given, and they will undergo for surgery, and after the surgery same that medications will be prescribed after the surgery also.